Hello, everyone. In the previous class, we learned about the median nerve. In this class, we will start learning about the ulnar nerve. Ulnar nerve. The ulnar nerve, C8, T1, arises from the medial bundle of the brachial plexus. After exiting the axilla between the axillary artery and vein, it descends along the medial side of the brachial artery and the medial bicipital groove. At the middle of the arm, it passes through the medial intermuscular septum to the ulnar nerve groove posterior to the medial epicondyle of the humerus. Then it descends through the origin of the flexor carpi ulnaris, turns to the anteromedial side of the forearm, and descends medial to the ulnar artery, between the flexor carpi ulnaris and flexor digitorum profundus, to above the radiocarpal joint, where it gives off the dorsal branch of the ulnar nerve. The main trunk is lateral to the pisiform bone. It passes superficial to the flexor retinaculum, divides into superficial and deep branches, and enters the palm deep to the palmar aponeurosis and superficial to the carpal tunnel. The ulnar nerve gives no branches in the arm. In the upper part of the forearm, its branches innervate the flexor carpi ulnaris and the ulnar half of the flexor digitorum profundus. Above the radiocarpal joint, the ulnar nerve sends up the dorsal branch, which turns to the dorsal side of the hand and innervates the skin of the ulnar half of the dorsum of the hand and the dorsal skin of the ulnar 2.5 fingers, hypothenar eminence, the little finger, and the ulnar half of the ring finger on the palmar side. The deep branch innervates the hypothenar muscles, adductor pollicis muscle, palmar interosseous muscles, dorsal interosseous muscles, and the third and fourth lumbrical muscles. The surface projection of the ulnar nerve is a line starting from the lower edge of the pectoralis major muscle and the pulsation point of the brachial artery origin, extending infromedially to between the medial epicondyle of the humerus and the olecranon, and continuing along the ulnar side of the forearm to the lateral side of the pisiform bone, posterior to the medial epicondyle of the humerus. The ulnar nerve is superficial in position, making it a common site for examining the ulnar nerve. Radial nerve. In the axilla, it is located posterior to the axillary artery and descends laterally accompanied by the deep brachial artery. It passes between the triceps brachii and the radial groove on the posterior surface of the humerus, spirals downward and laterally, passes through the lateral intermuscular septum above the lateral epicondyle of the humerus to between the brachioradialis and brachialis, and divides into superficial and deep terminal branches anterior to the lateral epicondyle of the humerus. The posterior brachial cutaneous nerve innervates the skin of the posterior brachial region. The lateral inferior brachial cutaneous nerve innervates the skin of the lower lateral arm, and the posterior antebrachial cutaneous nerve innervates the skin of the posterior forearm. The muscular branches innervate the triceps brachii muscle and coneus muscle, brachioradialis muscle, and extensor carpi radialis longus muscle. The articular branches innervate the elbow joint. 1. Superficial branch of radial nerve. The superficial branch of the radial nerve is one of the terminal branches and is a cutaneous branch. It descends from the anterolateral side of the lateral epicondyle of the humerus along the lateral side of the radial artery, turns to the dorsal side at the junction of the middle and lower 1/3 of the forearm, and divides into 4 to 5 dorsal digital nerves in the dorsal hand region. These nerves innervate the skin of the radial half of the dorsum of the hand, the dorsal skin of the proximal phalanx of the radial 2.5 fingers, and the joints. 2. Deep branch of radial nerve. Branch is the deep branch of the radial nerve, which is relatively thick and mainly a muscular branch. It passes lateral to the neck of the radius through the supinator to the posterior side of the forearm, descends between the superficial and deep extensor muscles of the forearm, and then descends along the posterior surface of the interosseous membrane of the forearm to the dorsal side of the wrist joint. Therefore, the deep branch is also called the posterior interosseous nerve. It gives off branches along the way, innervating the extensor muscles of the forearm, the distal radioulnar joint, the wrist joint, and the intrametacarpal joints. The surface projection of the radial nerve is a line from the intersection of the lower edge of the posterior axillary wall and the arm, passing obliquely over the posterior surface of the humerus to the lateral epicondyle of the humerus, which is the projection of the radial nerve trunk. In this class, we have learned about the ulnar nerve and radial nerve. In the next class, we will start learning about other nerves.